open enrollment for Medicare is going on now, and it's an opportunity to shop around to find the plan that's right for you. Joining us now to tell us what to consider before picking that plan is Shannon Abell. He's an AARP Virginia Community Ambassador. Welcome back to the show. Great to have you.
Thank you for having me.
Yes, I was reading up on this. I was watching videos. There's a lot of information and it can be confusing for a lot of people. So we appreciate you kind of breaking this down for us.
Sure.
There are 4 parts, right? There's A, B, and D.
And C.
And C. And then there's also Medicare Advantage.
Well, Medicare Advantage is Part C.
Is Part C.
Yes.
And then there's something called Medigap as well.
That's separate supplemental health insurance.
So there's a lot here to
You have a lot of choices.
dive into. Okay, so let's start with the cost of living adjustment for next year. That's going up for next year.
We're getting a 3.2% increase, which for the average senior on Social Security, it's about $50 a month.
Okay.
Last year we got 8.7%, but inflation is down, so we're not getting as much this upcoming year.
Right, okay. So let's talk a little bit about how that's going to affect the change in Part B premium.
Part B this year is going up $9.80. So part of your $50, you're going to lose about $10 of it because it's going up to $174.70. Yes.
Okay, all right, so something to consider. Let's talk about Part A. So what do people need to know about Part A?
Well, Part A, the deductible is going up to $1,632 for the first day in the hospital, but if you have a Medicare supplemental plan or if you have a Medicare Advantage plan, you won't have to pay, you may not have to pay that.
Okay, and then for the B, you just mentioned the deductible for
The deductible for that is going up to $240. So the first day that you go to your doctor in January or February, you'll pay the first $240, unless you have one of the Plan F supplemental plans that are out there that's no longer being sold, but some seniors have that. They have no deductible. All the rest of us will pay the $240.
Okay, all right, then let's dive into Medicare Part C. It's also known as the Medicare Advantage.
Right.
We're seeing a ton of commercials right now. This is sold by private companies, is that right? This is separate from what the government has.
You have to continue being enrolled in Medicare A and B to get Medicare Part C. You have to have an A and B.
Okay.
After you have that, then you can sign up for one of these plans that there's a number of insurance companies selling in the Roanoke area that are going to be selling these plans. The thing you have to be very careful about is you see all these things bang, all the benefits that I deserve. But if you think about it, as I've tried to tell people, how can the insurance companies give you all of these benefits and charge you zero premium?
Right.
So what we found a lot of times that they give you all these added benefits, but when it comes time for you to get a serious service like an MRI or a CT scan, these companies routinely deny them, and then your doctor has to fight to appeal. So it's a very risky thing that they work well if you're healthy. But if you develop a chronic disease like cancer, diabetes, osteoporosis, heart disease, you can find out that they have large deductibles, and sometimes your doctor ends up fighting with the insurance company trying to get the procedures and services that he wants you to have.
All right, so be careful.
Be very careful.
Buyer beware, because if it sounds too good to be true, it usually is,
I use that all the time, absolutely.
Yeah, exactly. All right, and open enrollment is going on now, and that's the time where you can change what you already have. You can change your options, right?
You can change to get a different drug plan, or you can switch and get a different Medicare Advantage plan if you want to switch. This year there's 8 insurance companies offering 21 different drug plans.
Wow. So
the premiums run from as little as $0 up to $100 a month. So you've got a wide range there. We urge everybody to go on to Medicare.gov and review with the plan finder to see if the drug plan you have works for you. Seniors get busy with Thanksgiving and Christmas and they forget about this, and then they go to the pharmacy in January and find out, oh, the plan raised prices on me and I didn't pay attention to all that massive paperwork that they send you in October.
Right, exactly. So you sit down, do it now. Now, if people have questions, you're available. You're going to hold some public meetings.
I will have at least 4 open to the public presentations around the valley here between now and the end of the month. I'll have a lot of handouts and information on all of this. If somebody needs to review their drug plan, they can also contact the local office on aging.
Yeah, that's important too. Yeah, don't try to figure it out on your own if you have questions. But on your screen right now are the upcoming presentations that you're going to give around the community. We'll also have that on our website at WDBJ7.com. But we do want to mention, for a free Roanoke area presentation on Medicare and scams, people can contact you and email you there at the email on your screen, because you have to be careful of that too.
You do.
So many things.
And I'm available. There's no charge for any of these presentations, so all they have to do is email me and I can try to line up a presentation.
Well, we certainly appreciate you doing that, because it's very confusing and there's a lot of information there. Shannon, thank you.